for joining us. Today, Jess and I are going to be talking about another common intervention that you will come up against, whether you're delivering in a hospital or at home, and it's your decision to make. So today's topic is vitamin K. Should you give it to your baby? Why do we use it? What's it for? So vitamin K, we're just going to delve in here and say it helps your baby's blood clot. A baby's blood does not naturally start clotting until around day 7. So why might you want to give it a hand? Why might you want to let it go? What are your options, and how do you make that decision?
So it's an interesting subject because all babies are born with lower than adult levels of vitamin K. So it's not really an abnormal thing. There's not really a lot of studies on this as to why that is. There's a lot of guessing as to why babies have lower vitamin K than adults, but there's no like hard facts. But it is something that's physiologically normal for babies to have lower than adult levels of vitamin K. So the reason why we're giving vitamin K is because there is a very rare disorder that's called vitamin K deficiency bleeding. It's called vitamin K deficiency bleeding, but it's interesting because it's not actually caused by a deficiency of vitamin K. Vitamin K fixes it though. They found that most babies that get this, and this can be, it's not just in the very beginning of life, it can be in the first 6 weeks of life or sometimes even later. And they found that those babies that get that really serious bleeding, usually the issue is that they have an undiagnosed liver condition that keeps them from being able to make their own clotting factors normally. So it's not that vitamin K is the problem, but it can,
solution.
It can stop that problem from happening. It's kind of like the Band-Aid. And so because some babies get this disorder, they decided as a public health measure to give all babies a dose of vitamin K at birth.
So, and let's talk about those numbers.
Yeah.
How often do we see it? It's 1 in every 10,000.
Yeah, somewhere between like 10 and 15,000 babies.
It's super rare.
Yeah. And so really this is a super personal issue over what risk factors are more scary to you as a parent. So for some people, they hear that thing, bleeding, which could go into their brain or into their abdomen. It can be super serious, and they're like, that sounds scary enough to me that I'm okay with giving the baby a vitamin K shot. And then there's other people that have this line of thinking that it's like, if babies have this lower than adult level of vitamin K, then there's a physiological reason for it. And what are we messing up when we intervene in this process of how the baby builds their clotting factors up normally? Like I said, there's not very many studies about this. There are some studies that show that it could cause an increase in childhood leukemia. There's other studies that show that it does not cause an increase in childhood leukemia. So it's not something that we have a lot of hard facts about. Just that we know it's a rare disease and the vitamin K can help it. Some of the risks of vitamin K, they have found that it can cause more jaundice in babies because you're messing with how the natural process of how their blood is clotting. And usually the vitamin K number one, it's not natural vitamin K, it's a synthetic vitamin K. The shot brings it to a level that is even higher than an adult level. And some of the brands of vitamin K also have other things in them to, keep it stable on a shelf.
Shelf life,
Yeah, that kind of thing. So preservatives and
toxins.
So it's not necessarily just
pure vitamin K.
Yeah, which there is some vitamin Ks that if they keep it in a fridge that it can just be vitamin K, so you'd have to ask your provider about that.
Unfortunately, most hospitals don't carry them because they are more expensive and they don't keep well. I will say a lot of our moms who do choose, at least in our experience, who do choose to use vitamin K will actually purchase the oral vitamin K, which is the body's natural way of absorbing it, is through the digestive tract. I also know a lot of moms who will choose to decline the vitamin K but will eat a diet rich in vitamin K so that it's being passed on through the breast milk, so they feel like they're kind of getting the best of both worlds.
which the studies are kind of like iffy on that as well,
Yeah.
because just like iron in breast milk, vitamin K is also super regulated in breast milk, which sometimes the medical community says, well, they're not getting vitamin K from breast milk
Right.
either, and then the people on the other side are saying,
There's a reason.
well, there's a reason
that
why
nature is not
nature
passing
is
along.
not giving them this vitamin K.
Right.
And we might not necessarily know what it is, but
Right.
nature usually has a reason for everything.
It is usually kind of right.
Yeah, so
The best way to operate the body.
so what are your options?
Right.
So your options are you decide that vitamin K deficiency bleeding is an important thing for you to
Right.
prevent, and you give the shot.
Which is usually in the delivery room.
It's in the delivery room. So if you decide to do that, you can ask for it to be delayed like at least an hour so that you have that really good skin to skin time and bonding time before baby's gotten a shot or anything. So that's one option. Another option is that you can purchase on your own oral vitamin K and choose to give that to your baby yourself. And that's not given all in one dose. It's given in consecutive doses over the first several weeks of your baby's life. So it'd be something that you would do even after you bring your baby home from the hospital. Or you can do nothing and you
Right.
can just monitor your signs,
Right.
your baby for signs of any problems.
I will
and-
say that we also see moms who choose to kind of do the wait and see. Babies are at a much lower risk and less for this bleeding unless they've had a traumatic birth. They're bruised up from the birth canal, things like that might kind of lead to, hey, there could be more bleeding. Then they'll choose to give it if baby comes out fine and there's no issues of birth trauma. They're like, we're just going to kind of let it go.
Yeah. And some things that can increase the risk of vitamin K deficiency bleeding are antibiotic use because vitamin K is made in the gut, which is why it slowly builds up as the baby's gut gets their bacteria built up. So antibiotic use before labor, during labor, or in your baby shortly after birth, that can be a risk factor for vitamin K deficiency bleeding. And certain medications you take during, we don't have time to cover all of them, but I know certain like anti-seizure medications can increase that risk of vitamin K deficiency bleeding as well. So if you have any of those issues, or if you have a family history of liver issues that could cause your baby to maybe have gotten those same liver issues that could cause an increase in vitamin K deficiency bleeding, that would be something to look into as well.
Right. All right, guys. We hope that was helpful, and we thank you for joining us, and we'll catch you again next week.
Bye.
Bye.